So the recognition of that emotional price, does that help you do your job better? Does it help you connect to the patient better? Like what is a practitioner that can do that versus a practitioner that can't? What's the advantage to the practitioner and what's the advantage to the patient when you can deduce that emotional cost?
I don't believe that the technical job is affected in any way. That's all about your skills, your hands, and what you do, what you know how to do technically.
Sure.
But there is no question that the connection to the patient, which to me was an enormous part of the job I did, uh, that makes it that makes the connection that the patient remembers forever. When I talk to patients who, let's say they had their knee replaced 2 weeks ago or 2 months ago, which I've run into people at my golf club all the time who I just had my knee replaced. And I said, "Oh, who did it?"
Some guy.
And they stop and they think. And that, well, it was in that office over by St. Vincent's. I can't remember their name. And that absolutely blows my mind.
Mm-hmm.
Because obviously that physician, hopefully technically they did a great job, but they did nothing to connect to the patient, even in a simple a capacity as the patient remembers their name.
Do you think that that's an aspect of that provider's just lack of emotional or social skill, or do you think that's an aspect of healthcare being this like crank them in, crank them out aspect, and you're getting in as many as you can, and it doesn't behoove a person to be able to make that emotional connection
I
or
think
evaluation?
I think that it's a little of the latter, in that healthcare and being a surgeon with a big volume practice, you're just going and but I believe that it has a lot to do with the practitioner's own skill at, everybody calls it the bedside manner. The bedside manner is not just at the bedside. The bedside manner begins when a patient walks into the door of the office.
But are we talking about this in the sense of this aspect about emotional connection or the emotional toll it takes on a patient to go through this is part of the overall care consideration and quality of care for this person's experience, the patient's experience from injury to release?
I believe that it is, but I know for a fact that is not the opinion or that is not the skill set of many practitioners. Um, I, good or bad, I had the opportunity to see lots of patients who had been somewhere else before.
Mm-hmm.
And their biggest complaint was their office is just like a factory. Go in there, nobody pays attention to you. I talked to the doctor and he never touched me. He looked at my x-rays and that was all he did. And he said, "Well, you need surgery and we'll have Joan come and get you all fixed up for surgery." To me, that is a big miss. I did lots of knee replacements. It's a big deal, but it once you do lots and lots and lots of them, it becomes because it's common for you, it's not a terribly difficult operation once you have that.
Yeah, I gotta ask,
ability.
do you have a number? Do you have a number of average of knee surgeries that you've done?
Well, I used to do between, in the last 10 years of my practice, I probably did between 150 and 200 a year.